This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Encicarb 100mg injection is an iron replacement medicine designed to effectively manage iron deficiency anemia, a condition characterized by a lack of adequate iron in the body necessary for producing hemoglobin in red blood cells. This injectable form of elemental iron is suitable for adults and adolescents over 14, providing a critical solution for those suffering from this common medical issue. Indications and uses. This injectable medication is indicated for individuals suffering from iron deficiency anemia, a condition where the body lacks sufficient iron to produce healthy red blood cells. It is particularly beneficial for adults and adolescents, helping restore iron levels and improve overall health. How it works. The mechanism of action involves iron 3-hydroxide complexed with a carbohydrate polymer, which efficiently releases iron into the bloodstream. This released iron plays a crucial role in hemoglobin synthesis, thereby increasing the red blood cell count and alleviating the symptoms associated with iron deficiency anemia. Directions for use. Encicarb 100mg injection is administered exclusively by a healthcare professional, either as an intravenous injection or infusion. The healthcare provider will determine the appropriate dosage and duration based on several factors, including the patient's age, body weight, and the severity of their condition. Possible side effects. Common side effects of this injection can include headache, dizziness, flushing, high blood pressure, nausea, and reactions at the injection site. It is important to monitor these effects and consult a physician if they worsen. Precautions and warnings. Before receiving this injection, it is essential to disclose any pre-existing conditions such as chronic kidney disease, liver disease, severe asthma, allergies, or infections. Special caution is warranted for pregnant or breastfeeding women, and elderly individuals should be monitored carefully during treatment. FAQs. 1. What is the use of this injection? It is used to manage iron deficiency anemia. 2. How does it work? It releases iron to help synthesize hemoglobin and increase red blood cell count. 3. Is it safe for those with kidney issues? It should be used with caution in such patients. 4. Who should avoid it? Individuals with iron overload or severe allergies to iron preparations. 5. Can it interact with other medications? Yes, inform your healthcare provider about all medications and supplements before starting treatment. Thank you for watching. If you have any questions or suggestions, feel free to leave a comment below. Your health is important, and staying informed about treatments like this one can help you or your loved ones manage conditions effectively.